A person's menstrual period is considered heavy if the flow, the bleeding lasts for more than 7 days, if you're having to change your pad or tampon more often than every hour, if you pass large clots consistently with your periods. Heavy menstrual periods is actually a fairly common occurrence. Approximately a third of women will actually seek medical care because of their heavy periods. If you have heavy periods, there's no need to be fearful that when you come in that we're going to always find something bad, but it's certainly something that if you're changing your pad frequently, you're having heavy flow, you really deserve to come in and get that checked. Heavy periods can actually cause health problems to a lady. One of the most obvious is that she become anemic or having a low blood count, which can cause a woman to have fatigue, and it can actually cause other health problems, heart problems to a woman who becomes severely anemic. But part of the problem with heavy periods is the underlying causes. And depending on the underlying cause of your heavy periods, it could definitely adversely affect your health. There are actually several common causes for a woman to have heavy periods. It can be something as simple as an infection. It could be some sort of an abnormal growth, such as fibroids, which are almost always benign growths in the uterus, or polyps. But then we can get more serious problems. There can actually be a bleeding disorder, underlying medical problems such as thyroid dysfunction that can cause a woman to have heavy periods. And then, of course, the thing that everybody is most fearful of is cancer. Fortunately, cancer is rarely the cause of just heavy menstrual periods. We evaluate a woman's heavy bleeding by beginning with a complete history and physical. That's going to probably include some lab work because some of the causes for the heavy bleeding can be irregular ovulation or hormonal imbalances. Then we check for thyroid hormone imbalances. Another thing that we do to evaluate the abnormal heavy bleeding is something called a saline infusion sonohysterography. It's a very special ultrasound that lets us look at the lining of the uterus, looking for polyps or fibroids. And sometimes we will actually obtain an endometrial biopsy, which is a small sampling of the lining to make certain that there are no abnormal cells that's contributing to the heavy bleeding. So at the end of your visit with us, then you may not know the exact cause of your heavy bleeding, but you will have a good understanding of the process, and we will have initiated the evaluation for your problem. There are several treatments for heavy bleeding, and it does not always include surgery. The most common treatment is probably some type of hormonal medication. And then we have non-hormonal medications that we can use. One is called Lysteta. And then we move into surgical treatments. It can be something as minimally invasive as an endometrial ablation, where you destroy the lining of the uterus, all the way to something as invasive as a hysterectomy.